Well, it is 1:03. Just to respect the folks' time they're here, maybe we can get started and maybe folks will join as we move forward. I don't think we have any votes today, but would love to reach quorum if possible. So good afternoon again, folks. My name is Michelle Glass. I use she, her pronouns. I'm one of the co-chairs along with Amy Fellows of this amazing committee, welcoming you to our November meeting. We're going to start, as we always do, with a tech check, a roll call for attendance, and a quick review of the agenda. So I will pass it over to our incredible staff team for tech check and roll call. Thanks so much.
Yes, so thank you, Michelle. We have just a little bit of overview of the Zoom settings. If you're not familiar, at the bottom of the screen, there should be different options for how you can view the sort of layout of the boxes today. And if you would like to hear today's meeting in Spanish, that option is available if you click the sort of globe icon in the bottom of your screen with the interpretation label. For committee members, there's the option to unmute and stop and start your video in the bottom left of the screen, and you can use the raise hand feature if you ever need to ask a question. And for members of the public, those features are not available as the discussions for the committee members, and we will have public comment at the end of the meeting. And I think with that, we can just keep moving into a roll call if that sounds good. Great. Okay, so for the roll call, Michelle Glass.
Present.
Thank you. Amy Fellows.
Here.
Thank you. Grace Huckog. I do not see Grace yet. Mickey Jerting, let us know that she'll be joining a little bit later. Juan Pablo Villalobos Garcia, do not see in the list. Colin Stackhouse.
Present.
Thank you. Max Brown.
Here.
Thank you. Jensina Hawkins.
Here.
Thank you. Jay Brown. Do not see Jay yet. John Buzzard. I do not see John. Craig Newton. Do not see Craig yet. Juana Jensina Hernandez Solis.
Here.
Thank you. Jocelyn Ogden, let us know she has a conflict. So that is everyone for today.
Thanks so much, Isabel. So we'll do a quick review of our agenda. Today, we will be doing committee and board updates, community engagement update, a work plan discussion, looking at our work plan that this committee has been moving forward, celebrating the great progress we've made this year and talking about where we're at in next steps. And then we always finish with updates from all of you, the committee members, meeting reflections and future topics from committee members, and hearing from the public. I want to thank everyone who's here from the public. Really appreciate you taking time to join this meeting. And are there any questions about the agenda? All right, hearing none, we will move forward and I will pass it over to our amazing executive director of the board. Mimi, thank you so much for bringing these updates and keeping us all connected.
Oh, thank you. Thank you. So good afternoon, everyone. I'm Mimi McDonald, the executive director of the Universal Health Plan Governance Board. And yes, as you can see with our first item up there on the list, what's happening at the board is a lot. It's also happening tomorrow. In case you have a little bit of free time and you'd either like to hop on over to Salem, I will say that I have bought snacks already. So everyone's welcome to come in person. You're also welcome to join online. So what the board will be talking about, one actually is the communications policy, which we'll be discussing a little bit later. There was an update to how the board is decided to communicate information out to the general public. So we'll talk about that in a little bit. Board is also going to look at the overarching administrative structure of the Universal Health Plan. That is a proposal that came through the operations committee, so they're going to be evaluating that. There was a quality strategy proposal that straw proposal that also, this one came through PD&E, that the board will be evaluating and voting on. And I will say the quality strategy itself, it's not like a list of metrics or things like that. It's really very general. In other words, how do we do this and how is that talked about? The board will talk about the mission statement that, and as you all have seen, and it's sort of come between sort of two similar but distinct mission statements that they're actually going to decide which one they would like to use. Hot topic always, how revenue is going to be generated and shifted. So that's on the docket. And then briefly a discussion about a hospital payment system, which also has been approved through the Plan Design and Expenditure Committee. A straw proposal has been approved. So phew, that's all tomorrow. Speaking of plan design and expenditure, they also have been very busy. As I mentioned, they created a lot of straw proposals. At the last PD&E meeting, we had a great presentation from our consultant group, Milliman, which came forth with a preliminary estimate of what the benefit package plan that has been agreed upon would cost. Now, that was sort of just an initial go round. And there will be a lot of changes to that, just based on some of the decisions that have been made. So that is something that is going to be reworked and come back. So as you all know, we've been using the sort of the cost target that was generated through the Joint Task Force. That data was from 2019, and then the report came out in 2022. So what Milliman is doing is using all much more current data. Again, PD&E also recently, as I mentioned, the quality hospital, and then did a review of long-term services and supports, and how that actually, there wasn't necessarily a proposal put forward, but how that is covered currently in the state of Oregon and the importance of it to healthcare. Next, operations. We have a meeting with the operations committee on Friday, and I apologize because I didn't get to update this slide in the way that I should have. So on the docket for operations, the Milliman administrative plan recommendations are actually going to come at December's meeting. So that's at the one to follow, but there's going to be a discussion about primary care and behavioral health operations, how that can be operationalized. Also discussion on eligibility and enrollment. Again, now we're sort of talking about the nuts and bolts of how that will be rolled out. And then, and this is, and also that we're going to hold off on the IT discussion until the next meeting, but this is when we're first going to start bringing up what a transition committee might look like, what were the topics. There's already been a lot of great work that the board did created a work plan for a transition committee. And so this is sort of the first time that we're going to go back into it. We're not going to spend a lot of time on it, but just really looking into sort of knowing where we are now, what we need to do and how to get there. So that will be upcoming. And then last, finance and revenue, never a dull moment, again, with the revenue proposal. And then our consultant group, Echo Northwest, is coming up again with more refined distributional analysis. In other words, what does this mean to all of these individuals and businesses if we do change sort of the structure of how revenue and healthcare is paid for? And then also further discussion about startup costs and reserves. So, phew, that was so much. I'd like to ask my Michelle and Amy, if there's anything you feel like, especially around the board meeting tomorrow, that you wanted to chime in or let people know about.
I don't have anything to add. I think
Oh.
that covers it.
I just lulled you all. I just barraged you with words. Okay. I think we can go on to the next slide.
Well, I wonder if committee members have any questions.
Oh, yeah.
Yeah.
Excuse me. My apologies.
And also the legislative yesterday's presentation, but maybe that's coming later.
That, you know what? That is an excellent point. And thank you for that, Amy. I don't know that we have a slide for that, but I will say that Chair Helen Belanca and Vice Chair Judy Richardson and myself, I'm in Salem today, but went across to the Capitol, did a 30-minute presentation before the Senate Healthcare Committee that has to do with what's been happening with the governance board and all the work that has happened to date. It was really an informational discussion. It wasn't sort of there was no specific ask other than to inform the committee of what we're up to, and to really encourage further discussion with our legislature, and to really try and be more involved with what's happening with the legislature and what their ideas are around healthcare. Obviously, super busy time, and their attention is pulled in a lot of different ways. So that happened yesterday. Thank you, Amy, for reminding me of that. And the 2025 annual report will be finalized. This is another thing at the board meeting, and then will be submitted to the legislature by December 1st. Yes, Amy. Thank you.
I'm thinking, I don't know if the video's out yet, but maybe when the video from yesterday is out, we can send it to the committee to watch if they are interested. The presentation to the legislature.
Thank you. And then I apologize. Let me look at my if we have a slide on this. I don't think so. So I think so now if if there are any other questions from committee members.
Yeah, hi, this is Colin. Just like a process to double check. So this is your meeting yesterday was like it's like obligatory, like once a year must give an update. Is that what that one was?
Yes.
Right, cool. And so we're gonna get the yearly report finalized tomorrow and submitted on December 1st back to the legislature for them to just, be aware of, right? Right, cool. I know that in the meeting materials it talked about the timeline for when the first draft of the plan, after we've like moved past some straw proposals. Can you speak to when we're hoping that's going to be? I know it's coming soon. And then there's no obligation for us to give that, for you guys to give a presentation to the legislature, like once that's completed, but what will the process be when there is first draft? Am I incorrect?
So I'm not sure when you're saying first draft, I'm not sure what you're talking about.
Oh, sorry. I guess that's how I've been using that language, like internally and with different Healthcare for All Oregon volunteers, because from my understanding, like there's a draft that we're before the 10 dedicated moments of like community engagement with the different stakeholders around the state, right? There needs to be some sort of like draft that's been suggested by the board, or am I misunderstanding how that process goes? My understanding, or I thought that there would be like a first draft and then we have several months of gathering feedback and then there's a few more months of like
I see.
finalizing.
Okay, thank
Yeah.
you. Thanks for, and please, Michelle and Amy, jump in here as well. So the way that I'm thinking about it, Colin, is of course, and Diana Bianco, excuse me, will be developing kind of the questions. I am not 100% certain there will be like an official first draft and then a second draft, because kind of everything is in like a massive iterative process thing. So there'll probably be point in time drafts or point in time drafts of specific subjects that will be discussed. So it's I would say it's more of that, although there certainly will be an agreement, because there's certainly going to be a baseline of information that needs to be provided to all of these external groups. So I don't know if Amy and Michelle, if you want to add a little bit further to that.
Yeah, I think that's a good summary, and it's a great question, Colin. Thank you. This has been a bit of a moving target, and I would say this has been the biggest challenge set before this board, because we have a charge that the task force didn't have and no other group has had until us, which is to actually do the hard work of mocking up how this might actually work and how it might pencil out. And that's very different from a conceptual framework. I think we can all agree on the concept, but the specifics are tricky and it takes a lot of heavy lifting in terms of analysis and modeling. And that has taken a lot more time than was first envisioned, I think, when I joined the board. We thought we would have, kind of a draft plan by June of 2025. And clearly that didn't happen. And I think what we've adjusted to is a couple of things. One, and we'll talk about this as we move forward in the agenda, I'm a volunteer, Amy's a volunteer, all the board members are volunteers, and we have demanding full-time day jobs and families, a lot of us. And so we are having to shift some things in how we structure the work of the board to even have the time and space to devote to developing a plan. So that we can get that clarity in front of those 10 focus groups with Diana Bianco. And then after that, once we incorporate that feedback, this group, part of our plan in the future is to figure out within our limited capacity and resources, how do we share it out beyond that? And if we're going to get there and meet our legislative deadline of next September, we are actually having to make some shifts to create the capacity to do that. And so we will be talking about that in this meeting. What we've shifted with how we're thinking about the engagement and what we're engaging people on is that we won't have like a final capital P plan. That's all, all the details are worked out and finalized in order to do these engagements. We will have straw proposal agreements at the board level for maybe a couple of options and trade-offs, right? So you would say, like, if we structure the finance and revenue plan like this, then we can afford to cover this kind of eligibility with this kind of benefits. If we change the benefits and the eligibility this way, then this is what the finance and revenue plan would have to be. And getting feedback from groups that we'll be doing this engagement with on how do you see those trade-offs impacting you, right? So that's how we're thinking about it. We're trying to get to that baseline analysis where we can clearly explain some of the key trade-offs and get some feedback on those trade-offs, and then incorporate that feedback in the final proposal that we submit to the legislature in September. Does that make sense? And does that answer your question, Colin?
It does. Yeah, to a degree. Yeah, thank you. I think that it does simplify. The fantasy of having a simplified first draft sounds great, but yeah, here we are. Yeah, when do you think, I hope that when we are communicating to these groups that we can make sure that we like really hone in about like that it is totally iterative, right? There's no like one final draft, because this whole thing's confusing even for people that are like very, very interested. And cool. There was one other thing I wanted to bring up. When may we, as Healthcare for All Oregon, or just like us in this committee, start talking about the different parts of the first drafts? I mean, I think that we can, yeah, I guess,
Will our
yes.
work plan slide, Mimi, maybe be helpful, like when we get to that part of the conversation for some of this? At least
Oh,
for a
I think it will.
timeline.
I think it
Yeah.
will, yes.
So we're almost there. Yeah, I think.
All right, cool. Yeah, thank you. That was clear. That clarified some stuff for me. So thanks.
Okay, and I will circle back to you, Colin. There are some future slides that I think, as Amy's saying, connect directly to what you're asking. So if we haven't answered this by the end of the meeting, please raise your hand, and we will make sure to do our best. But yes, everything you just said about it being confusing, I think every board member would also agree with you there. Go ahead, Craig.
Thank you. Hey, when you mentioned startup costs, it got me to thinking. I just read an article a day or two about how the state of Oregon went from in the black of about 470 million to, with the federal cuts, over 370 million in the red. Was there any feedback from the legislature hinting that, look, things obviously will get better, but did anyone hint at, like, look, we can't afford this right now, we should delay this? Was there any negative feedback? Thank you.
From the meeting yesterday, Craig, there wasn't anything like that. I think that probably that thought wasn't even in their heads about what we were doing. I'll be completely honest. I will say I don't know if it's available for public consumption, but I think there is a new forecast. I might do some furious Googling. Oh, good, Michelle's saying yes. for the state of Oregon, which has happier numbers. So it's not super happy, but happier is what I would say. But that's a great question. But no, we didn't get that kind of feedback. I mean, we're trying to share that what we are offering is a solution to some of these big challenges. So that's how we're trying to continue to keep engaged with this work and to keep the legislature engaged with the work.
Great. That's great to hear. Thank you.
I am just going to add, though, I think that is absolutely true. And I think that the other piece that I do just want to be transparent about that kind of relates to your question is that we are seeing a small cut to our current biennium funding for the work of the board. Right? Is that right, Mimi?
So that's still interestingly enough, that is still, there may be one that's very small. It's not the way our board is located within DCBS and an incredible organization. So it may not be say for example, a 5% decrease or anything like that. So that's still a little bit up in the air. So right now we're using the legislatively approved budget and have not had to make any substantial cuts at all.
So, okay, so let me clarify myself. Thank you, Mimi. And Mimi, please let me know if I'm off. But so every agency in the state has been asked to submit a list of programs that are new in the last couple of years that have been stood up, or programs that could potentially be places the state could cut if the state had to cut. And there's multiple scenarios. So there's a 5% cut scenario. So the agency submitted those lists, and then the legislature will decide in 2026 in the short session what of those options they may need to actually cut. So we expect to be able to complete our work as a board, and we're committed to that, and we see no threat to the work of the board from a budget cut perspective. But I just want to say, I know there's been a lot of discussion about like ask for more money. It's very possible we could lose a little bit of money as a cost saving measure. It's like being floated as a potential, but not enough to make our work impeded in any way. Is that an accurate statement, Mimi?
Yes, I would definitely agree with that. We're absolutely, going to keep going forward, and there is the potential for a relatively very small, which we would be able to absorb.
Great. So I just want to share that because I know a lot of people ask us about asking for more money, especially when it comes to community engagement funding. And so I don't see that in the cards with the current budget environment and with what we're looking at, but it's really encouraging that our work will be protected and we'll be able to complete our work as the legislature, charged us with. And one of the things that we are very clear about is that in our recommendations to the legislature, there will be a very explicit recommendation that before the legislature implement this, that whatever the legislature makes in terms of a final decision for what the plan looks like, that there be a broad, fully funded public engagement across the state of Oregon. So we're telling the legislature to plan for that, to budget for that, and that is part of the next phase of work. So just to anticipating some additional questions as we talk about budgets and economic forecasts in the 2026 short legislative session. So hopefully that was helpful in not muddying the waters further, but I do want to be transparent with you all. Thank you, Mimi. Is there any other questions for Mimi about these updates? All right, excellent. So community engagement. We did not meet in October, as you all know. We are in an interesting point in our work plan where we have completed the initial phase of our communications work stream, which is really exciting. You all have worked so hard, worked through so many drafts this year that we have like a full comms toolkit, and updated website content from that toolkit is going to be moving forward by the end of this month, which is really exciting. So thank you all for all of that hard work. And now that we are getting closer to having those plan scenarios that we just talked about to take to those 10 engagements with Diana Bianco came back to the board. Kind of her contract had been on pause since the spring. So she came back and we had our first meeting with her and Patty and staff this month to start re-engaging with the community engagement planning. So next slide, please. This is kind of a timeline. And so this is one of the things I think, Amy, you were referring to that hopefully answers some of your questions, Colin. This is our current anticipated timeline. So October and November, there were meetings with Diana Bianco to kind of catch her up on what's happened since her contract was put on pause, catch her up on the current timeline and thinking of the board's process and where the different committees are in drafting the finance and revenue plan, the operations plan, and the plan design. And then in December, Diana is going to do some additional planning meetings with staff to prepare for some meetings with the chairs of those committees, those key committees that are drafting the different elements of the Universal Health Plan. So Operations Committee Chair, the Finance and Revenue Committee Chair, the Plan Design and Expenditures Committee Chair, to really talk with them and say, okay, what do you see as the scenarios? When do you think that these straw proposals will be approved by the board? What questions do you have as you're doing this work that might need to come into these various focus groups? Kind of like the conversation we had with all of you in September, right? Where we brought up the list of groups that we need to engage with according to the legislative direction. And we said, what questions do you have for this group? What questions do you have for this group? What's important? What do we need to be thinking about? What do we need to be asking? So all of that feedback from you, we have shared with Diana. So thank you for that foundational work. And then Diana is going to be having that same conversation with these committee chairs as well. That is going to set Diana up for, really being able to have those questions drafted in time for like maybe mid to late February and through the month of March, having those 10 actual meetings. So Colin, to answer your question, we have been assured that there will be scenarios for February and March meetings. So I think that is our current plan. And then in April, that feedback from those engagements will come back to the board and will be incorporated into a final proposal to the legislature. Any questions on this timeline? Yeah, Colin.
Yeah, I guess it's not a timeline question, but thought that I guess is formulating now in real time about the input meetings with the legislatively specified groups. There's no there's 10 groups that are outlined, but there's no sort of I correct me please if I'm misunderstanding it, but it doesn't seem like there's a recommendation for how many different organizations per category should be involved. And so I guess my fear is like there'll be an offer maybe from the governance board to for example, I know insurance carriers, I believe, are part of those 10 stakeholders, right? And so there'll be an offer to have a conversation and feedback with as many insurance carriers as we can find in Oregon, and maybe only one will show up, and that will comply with the letter of the law, but it won't actually like get good feedback. Is that accurate, that it's sort of up to those organizations whether they engage, and is there a chance that they would just like choose not to?
That is such a great question, Colin. You asked the best question. So in answer to that question, I would say, unfortunately, the legislature has not gifted us with any magic wands that would allow us to compel people to come and talk to us. I'm being a little tongue-in-cheek. So it's a real risk. We have no control, of course, over whether people engage with us. And we know that from hard experience, right? The task force also tried to engage with insurers, and insurers said, no, thank you. We will not come to a focus group. Instead, we're going to write you a letter, right? So that did happen in the past. Now, my hope is that we can learn from that experience and that that a lot has shifted in the world since then. And my hope is that we can make a pitch that, we sincerely want to hear from people. We want this plan to work. And so we need key perspectives, right? And that it is an opportunity to have input, right? So my hope is that they will find that compelling, that they'll see the public support for this idea and decide that they would like to participate and have input. I also know that Diana Bianco is a well-respected, professional in the field. And so I hope that, a lot of this work comes down to relationships. And I hope that we are doing our work in a way that has, that communicates the integrity that we all hold, that we really do want to hear from people. We don't want people to only engage with people who already agree with us. We don't want to engage with people who are going to tell us what we want to hear. We want to hear all of it. Concerns, questions, this will work, this won't work. I mean, that is my sincere desire when it comes to public engagement, and I hope that we can convey that. If you or other members of the committee have specific ideas or recommendations on how to structure those invitations, we would love to hear it. But that is the reality. What we have been charged with is doing good faith engagement and making the invitation. We are not, our deliverable is not, feedback from every group. It is to make that invitation, to make that that attempt to gain that feedback, and then it is up to the individuals on the other side to say yes or no.
Cool. Thank you.
Yeah.
Thanks for artfully answering big challenging questions.
You're so kind.
Well, I mean, yeah. Another just on ways to frame the invitation, since this is a platform to talk about it,
please.
I hope that we can keep ringing the bell that it's like patients, speaking as a patient, I want, and many others with Healthcare for All Oregon behind me, we as patients want people to engage with the legislatively specified groups to come and engage with the board, and so we need it because we're sick. So yeah, and everyone knows that, right? But there's a lot of things everyone knows that nobody says. So
yeah, point well taken. Thank you for that. I appreciate it. Any other questions about this timeline? Oh, right. I think we're ready for the next slide then. So we're gonna connect this community engagement piece back to our larger work plan, and talk about all of our role in that. Next slide, please. Is there another one? Yes. Okay. So we can all celebrate that we have completed our communications work stream as a committee. When we started this work as a board and as a committee, there was nothing. There was there was an FAQ and a one-pager that the task force had created, but there was nothing for this phase of the work, right? So because of all of your leadership, we now have, and the board has, and it's publicly, we're trying to find ways to post it on the website and make it more widely available. There is a messaging strategy. That messaging strategy has been used to update the kind of template PowerPoint that board members use to talk with external groups. There is a one-pager that is very simple, which includes what's the board? What's it doing? Why is it doing it? When is it doing it? How do I participate? And then there's a more detailed one that has, more of the information and for people who are give me all the wonky details. We have, Amy and I have presented all of these materials to the board, and they were very well received. And we were able to share the detailed one-pager with the legislative as a submitted testimony. It's posted on OLIS, the Oregon Legislative Information System website, as part of our presentation to the legislature last year. And I think that really represented the work of the board very well. So I want to thank you all for helping us to create that basic toolkit of materials that then can be easily updated as board decisions are made, and we get to fill in those details of what the plan is. So take a moment, pat yourselves on the back, celebrate. We will be sending all of these materials out to you as attachments, kind of to answer one of your other questions, Colin, around like, what can we be doing? What can we be sharing? What can we be using as we engage with folks, whether it's our family, our neighbors, our coworkers, or whether you have like, you're a social media influencer like Colin. Then, those tools are right there for you, and, they're all board approved. They're ready to go for it. So that's exciting. Next slide, please. And that has allowed us to really pivot to this community engagement. And also, all those materials, when we have a focus group, it is so nice to have a clear one-pager that we can share with them. There's a great FAQ that's in our, messaging that has been created. All of that is going to support this next phase of engagement, which is really exciting. So we just talked about our community engagement timeline, and this is what Colin was just mentioning, the engagement with key partners as directed by the legislature, the minimum of 10 presentations on the workstream proposals, and getting this done early enough that we can incorporate all that feedback in the final draft, in the final proposal to the legislature. So these are our 2 work streams. One is complete. One is finally, after being on hold for quite a while, going into active phase. And is there another slide here? Let's see. Yeah. So where that brings us to is the work of this committee. Because the timeline we initially anticipated, which had a draft plan way earlier than turned out to be feasible. We had envisioned things moving very differently, but while we were waiting, we put all that time to good use, right? We knocked out all of our communications workstream products. Those are all complete and drafted and approved and have all of your feedback. You all worked really hard to create a style guide that's in use now. And then we had so much time that you all have already given feedback on the questions for these engagement groups. So where that puts us is that most of the work for the next couple of months is going to be internal, right? It's Diana meeting with staff, Diana meeting with the chairs of the other committees. It is having those 10 engagements. And so my proposal to you all, Amy, and my proposal to you all today is that we don't want to meet just to meet, and we want to respect your time and capacity and energy. And we know we're really, really, really going to need you next year when we get this feedback back. We would love your help reviewing the feedback from those engagements. We would love your help in creating that wider dissemination plan, right? For how within our limited time and monetary resources, we can share what the final proposal is. We don't want it to just go to the legislature. We want to share it as much as we can within our limitations. We want your help with those 2 pieces, and we envision that starting next April, May-ish, when we get the report back from Diana on those engagements. So what we propose is that we put this committee on pause for December, January, February, March to allow that work to move forward, and we reconvene when we have that report back on the engagement and we have work for this committee to do again. So that does 2 things. Well, it does more than 2 things. One, it respects your time because there's not really anything left on our work plan to do between now and then. It's not a good time. It's going to be really the messy middle of the board wrestling with these huge straw proposals about what those details are so that we can have them ready in time for those engagements. So it's not a great time to be ramping up a lot of public engagement because it's literally the most confusing time and everything is up in the air. And we want to have something to communicate about. And that is a draft plan for people, or plan options for people to respond to and tell us what they think of. And so Amy and I, as board members and volunteers, really need to be able to put the capacity and time that we've been putting into this committee into being part of that larger board to participate in the evaluation of those straw proposals. And then this work group doesn't have anything left on its work plan until we get that report back from Diana and then create that dissemination plan. So that's kind of the thinking, is that we would go dormant for a couple of months, come back when that report comes back, and then finish out your role in the wider dissemination plan, evaluating the feedback, and helping us to craft that feedback into the final report to the legislature. So you can see that on this timeline here. So this timeline, you can see like this is the name of our committee at the top. The next line is the CECC timeline. So this is 2025, June through December, and then 2026. You can see the Wentz Consulting timeline here was really active from June through October. And then, that was the style guiding, that was our style guide work, that was the one-pagers, that was the strategic messaging work, that was the website content, that was the work on the mission statements, all that work that we've been doing with Patty. And now in November, we are starting the targeted presentation development with Diana, which you all have already given your input on. Then the targeted presentations will take place in February and March. And then in April, as that feedback comes back to the board, it would also come back to this committee. So when it comes back, we'll be creating that dissemination plan and implementing it, and you all will be part of that work. And that'll run through September of next year, when our final report is due to the legislature with the plan that reflects the feedback from that engagement. Do folks have any questions about that? Does that make sense? And also I'm seeing, Jensina, I'm seeing your comment, plants always bloom more after they've gone dormant for a month or two. Yes. And I'm really, really hoping that you will come back. My biggest fear in putting this on pause is that you all have also busy lives. You're also volunteers. I'm so, so grateful for each of you and have loved working with you. And I would be so sad if we couldn't all come back together next spring, although I would, of course, understand. But that is my highest hope, is that everyone will be able to come back. So yeah, I just want to open it up. Any questions, any comments? Craig.
Hey, thank you. Hey, I got to thinking, I probably asked this question before, but after we go through all this, and let's say the legislature approves this, forgive me for being so naive, does it just get implemented, or does it have to go before the voters of Oregon before this plan can be implemented? Thank you.
Craig, I can count on you to ask me the toughest questions. Thank you for keeping me on my toes. I will do my very best with my crystal ball. The truth is, it's up to the legislature to a point, because this includes, is likely to, I should say, the board has not made any final decisions about the finance and revenue plan, but if this plan, as anticipated, does include changes to taxes, then it is subject to that very, very high threshold of a 3/5 majority vote in the House and the Senate. And my expectation is that, yes, the legislature is it is very likely to go before voters before the end. I don't know of a path that wouldn't include a vote of Oregonians. But yeah, that is my expectation, is that there will be a vote.
Okay.
It will end up on the ballot at some point. It's my best guess.
Okay. Thank you. Thank you.
Yeah. Thanks for asking that question. I think a lot of people are wondering that. Other questions? Colin.
Yeah. I appreciate Jensina's comment about how flowers or things bloom more when they're dormant. I'm a little I think we've already talked about this, but why not? I feel like bringing it up again, which is that I think a lot of us joined this community engagement and communications committee with the hope that we would participate in some of those community engagement and communications moments with the different stakeholder groups, and it's been made clear that we're helping develop, and then we're gonna come back in April probably and you know, talk about them. So yeah, I guess I want to bring it up like this committee meeting, just even like existing, is just like yet another pathway for people to engage with the governance board. And part of our testimony that Healthcare for All Oregon, I didn't spearhead the document that we submitted as part of public comments, but the interaction with the public is like very bad, and it's challenging to see, and it feels yeah, it feels consistently like bad, right? And so having this like relying on Diana Bianco with these targeted presentations that members of this communications committee aren't able to participate in at all, like sort of leaves a lot of questions. Like one specifically, like there's one of the 10 groups is the healthcare consumers, like everybody in this call and everybody in the state of Oregon. And I guess my hope is that it would be like publicly broadcast for Oregonians to participate in their like one singular chance to talk to the governance board in this kind of format. Granted, there are like lots of public engagement opportunities, but like in these meetings, right? So to go away with these meetings and like have one less opportunity to speak to the governance board is doesn't seem great. But and also I get it, like if the scope of this group is not actually the community engagement or the communications, but to develop and then like digest, sure. So I guess one question maybe that would ease my apprehension would be like, are those 10, will we as the public have information about those 10 targeted presentations? And can we encourage as many people as possible, insurance carriers, small businesses, whoever, to apply? Or is it like so targeted that it cannot be publicly made known? That's, I guess, my question.
Yeah, thanks for that feedback and that question, Colin. I certainly hear you. And I think that that is one of the challenge for those of us, I would count myself included, who have been advocates and activists throughout our lives, and are now in kind of this like internal government role, which is about leadership. It's about governance. It's about creating plans and evaluating plans. And it's, you know, when you're part of a scrappy grassroots group, you just do everything, and right, like it's just how it is. And this is different. So again, I apologize for, I think I could have done better. We could have done better at the beginning when we sent out the recruitment materials, making it clear what this was and what it wasn't, that it wasn't a speakers bureau, you know, what the role would be. And I know this is a group that is ready to roll up its sleeves and get to work. And I'm really grateful. And I think that's served us well, right? I think that having those perspectives of like people who have their own lived experience, work directly with community, do engagement, crafting the materials will really serve us well now and far into the future. And I understand that it's like less satisfying, right, to be in that kind of a role when you're used to be the one outside banging down the doors, right? And like, you know, doing the stuff, being really active. This is, it's a different type of the work, but I really, really appreciate the engagement in spite of that disappointment and that, you know, mismatch that I think a lot of people felt and have expressed here in this committee between what they were hoping this would be and what it actually is. So I want to again apologize for not making that more clear, and thank you for sticking with us anyway, because I think that you've had a real impact, and you're exactly who I hoped would apply and join and help craft these materials and the planning for the engagement, because you can always tell, right, when engagement has been planned by people who theoretically understand the issues but don't live them or don't have daily engagement with the communities who will be impacted. And I think that having folks who do have that lived experience and that daily interaction is crucial. So I'm so grateful. And I also hear the disappointment. On the point around engagement, I think this is how I'm thinking about it. You may disagree. That's totally fine. But let me share my perspective on it. And this is literally something that's kept me awake at night. This is something I've thought about for weeks and really struggle with. Because I came, to the board to do engagement. That's what motivated me to apply. As someone who lives with chronic conditions, who has family members who have chronic conditions, who has lived without insurance, was an uninsured single mother, knows the fear of not knowing what would happen to my child if something happened to me. and who works directly with communities impacted by health disparities every day. That's why I'm here. And what I've come to believe is that this work that we've all stepped into, that is decades in the making. I mean, we all know champions that have been working for healthcare for 50 years, right? I've been mentored by some of those people. You all probably have been. Some people on the call might be those people. So thank you. I don't want to be in that same place of fighting for, hoping for, organizing towards universal healthcare 50 years from now or 10 years from now. I don't. And the task force did great engagement, and they prioritized the most impacted groups first. They engaged with unions, they engaged with BIPOC communities, they engaged with rural communities. Like, that was the first focus. And I'm so proud of that. And I'm so grateful for that work. And that was before there was a plan, right? It was all conceptual. And that feedback we have been able to use to build the plan. So there was conceptual feedback. That was one of the first steps. We have an opportunity right now, after 50 plus years of organizing, to have the consultant support, to have the financing, publicly funded budget to do the actuarial work that's needed, that's boring, that's complicated, that's time consuming, that's confusing. Like, we get to do that work now, and we have a very small window to do it. And it is a huge lift, right? And if we are going to get that work done, we have to focus. And we all have very limited capacity and time because we're volunteers, because of our really strong commitment to transparency. We basically have a couple of hours a month as a board to deliberate and make decisions. That's it. And that is a very small window to fit this huge body of work into. And so how I see it right now is that we can either stay in this churn of focusing our limited resources on telling people in Oregon, like, there's a board and there's a process and we want your feedback. And like, what do you think about universal health care? And we don't have answers to any of the specific questions. Like, how is it going to impact me? Are my taxes going to go up? Is this benefit going to be covered? What will happen with my employer coverage? We don't have any of those answers yet because we are struggling to create the capacity to build plan options, right? And this is like, make it or break it. If we miss this window, I don't think in this current environment, politically, economically, with all the other priorities the state of Oregon has, I don't think there will be another opportunity like this. I don't. And so I would ask for continued public comment. I know it has limitations. I know it's not the most accessible process. I know it's not ideal. I read every single one. I make notes based on public comment about questions to ask about the proposal, about things to watch for, about things to make sure are in the final plan options. Your public comments, for anyone who's listening, have made, have changed, I have stalled votes for public comment, right, before. Like, we really take them seriously. It really matters, whether it's written or spoken. And we are clear that we have to do broad public engagement. The question is when and how. If we did it now with limited time and resources, I don't think I could do both. I couldn't fully participate in the board deliberations and read all the packets in time and do this work and do community engagement. I just don't have the capacity. And I think a lot of board members are in that situation, unless they're, we do have some really awesome champions who are retired, and we're so grateful. But that's the reality. And I believe that the process is strengthened by having working people who are raising families participating as well. So, that's not to say that I think only retired people should participate. But if we did engagement now, it would be imperfect, it would be limited, we wouldn't have satisfying answers, and we would be stuck in this place. If instead we pause on ramping up engagement, do this work, make this hope real, right? Take the next step towards making this a reality and not just a concept that we all hope for. And then do whatever public engagement we can, which I think we can do a lot next summer, with plan options that people can respond to, right? I think that's more empowering and impactful than like, here's this amorphous idea of a plan with 6 straw proposals and here's a PDF with 70 pages of actuarial information. Like, that's really difficult to give feedback on, honestly. But I think that we can take the plan options and put them into a way that is more plain language and that people can figure out like, oh, what does this mean for me? What do I think of this? How does this work for me? And get more granular feedback that we can take to the legislature and recommend to the legislature that they fund, now that we've done all this work, right? This work that no one else has done yet in the history of working for universal healthcare in Oregon. Recommend to the legislature, now that we have something to communicate about, this needs to be fully funded. This needs to be fully capacitated. This has to be the next priority. So it's not that I don't think it should happen. It's about what is possible in this imperfect, limited capacity moment in terms of like capacity, in terms of timeline, in terms of individual capacity, in terms of capacity as a board with the number of hours we have per month where we can engage with this. Because we're not having behind closed doors conversations. This isn't happening in closed, back rooms with cigars. This is happening in public meetings, and that limits us, right? So all of that to say, I'm with you, Colin. I have a lot of passion for transparency and public engagement, and this is how I am thinking about this tough decision in this moment. And I hope that people will continue to share their public engagement, and I hope that you will all come back and help us do a dissemination plan next summer. And I also acknowledge that this might not answer your concern, and I hear that too. That the answer might be like, that's not good enough, and I'm here to hear that too. Go ahead, Amy.
Yeah, I just wanted to thank you, Michelle, for all of that, and just in agreement, similar situation. And as a volunteer, this is the point where I really need to be able to fully engage in the other work group meetings. And Michelle and I have been talking about how we can kind of divide and conquer and make sure that we are in those other meetings. But as a solo parent of a disabled child, which is the reason that I'm on this board, I have not been able to watch every single committee meeting for every other committee and stay up to speed on all of those and work multiple jobs to keep a roof over our heads. So so having this pause now gives us the opportunity to be able to further engage in those other committee meetings when these important conversations are happening. So it's not just getting the update once a month at the board meeting and then making those decisions. So I just wanted to kind of give that perspective as well.
Thank you, Amy.
Yeah. Thank you both for your work. Truly, I mean, like it's thankless. So thanks again. And for yeah, sharing your perspective. Cool. Yeah, no, I think if that's what the two of you truly as like this committee is like go between the community engagement, communications, development, dissemination, and the board, if that's what you guys need to make a plan that's going to work, like then we got to do it. That's like part of it. My thought, maybe just me because I'm antsy and very curious about this, but like since it's going to be perhaps a 4-month break, just like looking at the calendar, like November, December, January, February, March, and then us coming back, hopefully most of us coming back or all of us coming back in April. I think that if that's the reality, I'd like to request some sort of check-in, maybe in January or February, like to just hear for an hour how the targeted presentations are going. That being said, maybe we could get that from a governance board meeting, but perhaps people in this group would also be interested in like one brief check-in in that 5-month break. And then this question, maybe Mimi could better answer it, just about those targeted presentations. I am curious if we, the public, will know when those targeted presentations are going to happen, and if there is at all any opportunity for us to encourage, specifically for that healthcare consumer, to encourage people to engage, or is there a limit on the healthcare consumer? Like, will it only be 10 people in sort of a focus group, or will it be this sort of broad thing? Just curious.
I do wish I had the exact answers for you. So I certainly don't want to misspeak. I do know that there is a kind of a number, and Michelle and Amy, we even talked with Diana about this, like, what is a good number of people in a, because, you know, these are going to be virtual, like in a virtual meeting, that it is that you truly can get feedback. And like in my head, it's somewhere, I think she said around 15 or something. So these are not town halls, because they truly are meant to really draw people to. So that's the second half of your question, Colin. But Amy, Michelle, anyone else who was, when we were talking with Diana, help me out there. And then in terms of timeline and thing, or, you know, when things are happening and what things are happening, Michelle and Amy will still at every they don't get to get out of board meetings. No, they will be there and they will be presenting all of the information about what's happening with CECC. So you're absolutely correct that there is a time for that. And having said that, I am absolutely down for having some, you know, kind of end of winter, early beginning of spring, like get together, update, whatever. I mean, you know, absolutely happy to figure out something like that, where it's really just like an opportunity to, like, yeah, let's share what's going on. So all of those things are possible.
Yeah, thanks for that proposal, Colin, and thanks for fielding that question, Mimi. I think because we've been specifically asked to fill in gaps in the engagement from what the task force was able to, the folks the task force was able to hear from. And depending on what some of the questions are that the chairs of these various work groups feel we really need to, you know, like, if the trade-off is between this and that, like, what perspectives are going to be really key for helping us understand what the impacts of that decision is. I think there's so many strategic considerations that it's not going to be an open application process. It's going to be an intentional, targeted recruitment process. And so you all have already given feedback on, like, some of the groups that, you know, brainstorming some of the groups and brainstorming some of the questions. So we'll continue to welcome any of that feedback. If you have people in mind, if you have groups in mind, you can email them to us to go into that process. And, you know, but that is going to be the process. It's not like there's going to be an application on the website, or like Mimi was saying, that we're not at the stage yet for town halls. So to answer that question, you know, I think that is where we're at with that. And I love the idea of a check-in, you know, like an hour to, like, Q&A and hear how folks are doing and share how the project is moving forward. I guess with these engagements planned to start in February, when would you all like to check in? Do you want to check in, like, at the end of February and kind of get, like, a midstream, like, here's how the first few went, here's what's coming up? Or, like, yeah, when would be, in your mind, a good time to do that?
Personally, yeah, I don't know, either one, maybe like right before they kick off or midstream, sounds smart as well. So I would, yeah, defer to what everyone else
Maybe
thinks.
like in January when we have a solid plan with Diana about what the engagement plan is.
I'm curious. Yeah, so I'd like that, but I don't want to waste other people's time too. So
Jensina, yeah.
So once again, I agree with everything Colin has been questioning and suggesting. And I love the idea of having kind of a new year kickoff. Hey, this is a new year. We've got additional projects, programs. This is the progress that has been made so far at the board. So I'm in complete alignment with what Colin's suggesting.
Love it. All right, we've got a date, y'all. January. Go ahead, Craig.
Oh, that's fine. Yeah, no, I was just gonna say, I have no objections to a meeting, and if we don't want to do a meeting, an email update would be fine too. Just saying where things are at. Thank you.
Craig, did you just ask us if this meeting could be an email? No, I'm just kidding. That sounds great. And of course, we'll understand if folks can't make it, and we'll do our best to send out a rich email update in addition. I think we can do both. But yes, I think having both options makes a lot of sense. And oh man, Gentina, meetings without food. I know this is the thing that makes me so sad about remote meetings. I would love to bring snacks to this meeting. You have no idea. Okay, the organizer and me just like, yeah, meetings without food. Okay. Any other questions, comments? Go ahead, Colin.
Thank you. Yeah, I think you guys probably can guess, Mimi and Michelle and Amy, that Healthcare for All Oregon is like hungry for a town hall or some sort of public communication and large scale conversation about this. So I heard Michelle, you say we're not ready for a town hall. Totally true. But Mimi, you brought up that phrase, and so we want them. And so I hope we can get something like them sometime.
Thanks, Colin. And I think there's also nothing stopping any external advocacy group from doing just that. You know, the publicly posted materials, the one pagers, we really hope that those are resources for people who want to engage with this work. Yeah, the work doesn't start or end with us. And I also hear you. Okay, Max Brown says, yes, late January sounds great for a check-in meeting, followed by the meetings reconvening in April. I think we have a plan. Thank you all. And I love this amendment of a check-in for about an hour in January. So great. The other thing that might be a great opportunity for is to, if there has been significant progress in the plan specifics, then Patty will be working hard to update our materials. And so we will certainly be sharing materials as they are updated with all of you as well. So go ahead, Amy.
My logistics brain wants to know, in terms of both the January meeting and then reconvening starting in April, would it be best if we keep this last Wednesday at 1 o'clock time, since you currently have it blocked on your calendars in terms of a January and then rebooting in April, rather than try to find a new time for those?
Great point. I guess the question is, do folks want a doodle poll? I laugh because nobody wants a doodle poll, but
Yeah.
if
or keeping this kind of,
keep this, yeah, that's the simple answer. So maybe thumbs up, let us know in the chat or with a thumbs up if you would like to keep it in within our current meeting schedule.
which is, it's usually last Friday or last Wednesday. Today's kind of confusing because of Thanksgiving. I think we moved it back a week.
Thank you for that note. Yeah. Perfect. It looks like most people, yes, so far consensus is we keep our schedule. Thank you so much, logistics queen Amy, for that very practical question. All right, last call for questions and comments on our next steps as a committee. All right, hearing none. Oh, Craig, up for a doodle poll. What a trooper. Thank you. It looks like so far no one has objected to keeping our current schedule. So I think you're all off the hook for responding to a doodle poll. But I appreciate your willingness, Craig. Next slide, please. All right. Open forum for committee member updates. Feel free to raise your hand if you have an update on engagement or things you're hearing or anything related to our work. We would love to hear, or upcoming meetings, webinars. What you got? Yeah, Colin.
Sure. Yep. I basically was going through right before this meeting to look at everything Healthcare for All Oregon's done in the last like 7 weeks since our September 24th meeting. So basically anytime Healthcare for All Oregon is doing anything, we talk about the governance board. So that's like, they're one and the same currently and for the next 3 years, right? So we've done some testimony workshops on how to submit testimony to the governance board. We've done 5 and there's another one today. Lou Siniger, who's on, I think on the call, he and I were on KRVM in Eugene in October. We've had 18 virtual Healthcare for All Oregon 101 classes where we walk people through like who we are and who the board is and like the history of that. We participated at the No Kings protest. So we were in Eugene, Portland, Medford, Corvallis, Astoria, Roseburg, Bend, and LeGrand, talking to people about the governance board. And we've had around the state maybe 8 community conversations in various places where an in-person or virtual, but mostly in-person format talking about the board. Dr. Tony German, who's on the plan design committee, and Dr. Richard Bruno talked with at OHSU with the Students for National Health program a few weeks ago. And we've had 3 webinars, which I will put the links in the chat since we have chat now, but we've had some virtual webinars focused on like the intersection of universal healthcare and different things that are relevant to all of our work, right? So we've had one about labor, a labor webinar, a webinar sort of diving into Taiwan, and Dr. Chen Wei Chi was able to participate, the governance board member. And we did another webinar about the intersection of like veterans, issues and what universal healthcare could look like in Oregon. So lots and lots. Good.
Thank you for all that work, Colin, and HCAO. Many of you are on the meeting.
Yeah, it's mostly led by volunteers. I mean, it's incredible.
Great. Thanks for that inspiring update. Anyone else? Other updates?
I actually have one Friday, which I had to use our new or tomorrow approved board process for board members doing our communication and presentation type work. So I'm involved in the Lane and Douglas Regional Health Equity Coalition. It's called Rise of the Umpqua Willamette Valleys. And we're having a conversation on Friday around HR1 and Medicaid, and actually Les Rogers, who was part of the task force and was kind of a disability lens person because he's also a parent of a disabled child, is kind of giving the HR1 and what's happening with Medicaid part. And then I'm going to be trying to infuse some hope and talking about the work of the Universal Health Plan Governance Board at the end of that. So it's community-based organizations, CCOs, other folks that are involved in the Regional Health Equity Coalition in Lane and Douglas counties.
Thanks, Amy. That's exciting. I'm glad that the Recs are staying engaged at the work. Thanks for making that presentation. Any other updates? Craig.
We nothing earth-shattering. I'm on a couple other health boards. The one that comes to mind first is Jackson Care Connect down here in Medford, Oregon, in Jackson County. We, of course, with all the budget cuts, we've had a couple of emergency meetings to decide our path forward, and so it's been kind of scary, but I think we're weathering the storm like everyone. It's not much of an update, but I mean, that's what we've been focusing on at our last meetings, just how to prioritize things and what cuts may be coming in the future. Nothing's really been fleshed out yet, but that's it. Thank you.
Thanks for that perspective. So just to clarify, you're on the Community Advisory Council for Jackson Care Connect?
Yeah, I'm on the board of directors, and
Okay.
And then I'm the chairman of the Community Advisory Council.
Okay.
And then I sit on the Jackson County Democrats Healthcare Caucus. But anyway, thank you.
Okay. Just to say it out loud, for anyone listening, this is a nonpartisan space here. But I thought I'd seen your name on the list of the CAC, so thanks for clarifying that you're on both. That's great. Any other updates? All right, thanks y'all for doing the work. Like I said, we're going to send out the final version of the materials because I know that you all do a lot of engagement. So my hope is that they're supportive of that engagement. Of course, between now and January, when we come back together, if you have questions or ever want to, need to get a copy again of the most recent materials, be in touch, email us, feel free to email us. We'd love to stay in touch as needed or as you have updates or requests of us. And if there's no other updates today, when we come, let's go to the next slide. So when we come back in April, we will have some meaty topics to dig into. We'll have a report from the engagement and we'll have some dissemination planning to do. But would love to hear your reflections on this meeting and any other future topics, anything else you'd like us to be preparing for either our January check-in or our April meeting that you think would be helpful for this work. So I'll open it up to members of the committee.
I think the only, I'll say it again, but I think some sort of town hall like ability that's outside of some sort of town hall like discussion that's outside of the hours of the board, like 9 a.m. to 12 p.m. on a Thursday, would be helpful for a lot of members of the public to engage and ask questions. Which, yeah, after the sort of like the pressure cooker between now and April, I hope that we can do something like that. So, yeah.
Thanks, Colin. And just for, I'm going to steal that. So between now and March, do you say woof? I'm going to use that now, woof. All right, any other reflections or future topics? Great. If something comes up to mind, send us an email. Otherwise, we will be talking about those 2 agenda items that we just discussed when we come back together. So that brings us to our final agenda item, to the opportunity to hear from members of the public who are here. Do we have folks signed up?
We do. I'm going to double check though. These people signed up for our September meeting, which we didn't have. So I want to, they're
October.
so I want to just double check. The people we had signed up were Bobby Hall and Lou Sininger. So I want to, we'll give you both the opportunity to share your comment if it's still useful in October. But for the record, yes, we always really appreciate public comment. The written public comment is included in the meeting materials for this meeting, and those can be submitted up to 72 hours in advance of the meeting. And for oral public testimony, like we're about to do, we ask that people sign up 24 hours in advance of the meeting. We'll have about 2 minutes for each speaker, and I'll put the timer up on the screen in a second, and I'll put the link in the chat for where people can sign up for public testimony. And I think those are my points. So Bobby, if you would like to speak this month, I can hand it over to you.
Am I on?
I have Bobby first and then you, Lou.
Oh, okay. Where's
I
Bob?
think I unmuted.
There we go.
And
I hear you.
No.
Okay.
Okay. I was going to talk about suggesting someone for speaking at the meeting, but I understand we're not meeting again. So let me just say that I have worked a lot with our 9 healthcare tribes, our registered national tribes, and I know they are under attack from our present government after, gosh, the last 30 years of making a lot of progress. And there is a board that has been established that interacts between the tribes and the federal government plans for American Indians. It's a very large and very important one. It's one that I did a couple of projects with over the years, and I think they would be a good group to involve with each tribe. Each of our 9 publicly supported tribes has a member to it, and they interact between their tribe and the federal government. And I think they are a very good tribe to work with. I've worked with them some. And I think things are going to get worse rather than better. And I've done a lot of, I've worked with the Coquille Indian tribe. I helped them get registered again. And I've worked with other tribes of the coast on issues related to the plants, not the plants, the animals. So I'm sorry. I would really like to help with that if I could. Thank you. I'm a emeritus professor at OSU.
Thank you so much, Bobby. Appreciate it. And I appreciate your written comment as well.
Thank you.
Thank you. And now over to you, Lou.
Thank you. So I can really identify with you, Michelle, and everybody else on the committee about volunteering. When we were pushing for this thing to happen, I was hoping to get at least the whole board paid for. But I've been volunteering to bring universal care into Oregon for 12 years now. And so I can really identify with your situation. But I'm in hopes that, right at the first of the program, you came out with that you have the one pager, you've got the final version of materials that you want to send out. I was hoping that this committee is part of the state now, and the state could deliver, you could deliver to those groups identified that those materials and your desire to have virtual meetings with these groups. The reason why I think it's important, HCAO can talk about it, but we're kind of like pie in the sky, right? But when it comes from the state, that's serious. So a notice to your identified groups that this is coming up, prepare, and whatever you have in materials, I don't have access to those yet, and I hope to get them. I think that would give them warning, because I've been working so hard. But I keep meeting people, doctors, all kinds of professional people that have no clue, union people that have very little clue about the governance board. I swear it's the best kept secret in the state. So any way that you can notify people that this is coming up would really help. Antonio's going to be at the City Club on December 5th, Friday, and then it'll be aired on December 7th, the following Monday, on KLCC if you want to listen. Sorry, did I go over time? No, I still got time. So let me get this straight. Now, you're going to meet in January on the 4th Wednesday, is that correct? At 1 o'clock. Yeah. Okay. Thumbs up. Okay. I just really wanted to stress that. And the last thought I had, you have community organizations community service organizations. I would think that unions would fall under that category. I think it's so important that you set aside some notice for unions to be involved in this final race to the end of the to the finish line here. Thank you. I went over a lot. I'm sorry.
Thanks, Lou. Thanks for always being with us. We'll see you in January, I'm sure. Appreciate it. And thanks for your 12 years of working for Universal Healthcare. All right. We are really grateful. Thanks, Amy, for dropping the link to the City Club of Eugene engagement that we just mentioned. Thank you to everyone who has joined us on Zoom or everyone watching in the future on the internet. Really appreciate each member of this committee. I think you have a lot of work that we've accomplished this year to be proud of. It wouldn't have happened without you, and the perspectives that you bring, all of your time reviewing and in making recommendations and edits is now being put into practice, right, in this engagement planning. So thank you, congratulations. I hope you all have safe, cozy holiday season, whatever holidays you may celebrate, and we will see you back here at 1 p.m. the 4th Wednesday of January, which will be posted on the website, and an email will be sent out per usual. And until then, be safe. Don't be a stranger. Take good care. Thank you again. Have a great day.
Thanks, everyone. Bye.